Hello, this is Dr. Ryan Bell again with Yada Yada. Let's talk about urinary tract infections. So a lot of patients, especially our younger girls, at some point in time will struggle with complaints such as it hurts when I pee, there's itching down in my private areas, there's vaginal discharge. Those types of complaints always get us a little bit concerned about bacterial urinary tract infections. If your child has a bacterial urinary tract infection, you don't want to delay getting it diagnosed and treated. The reason is that bacteria can start to travel upstream, can cause some pretty serious infections if it gets to the kidneys. We call that a pyelonephritis. Symptoms that we worry about will be fevers, abdominal pain, especially if it's in the bladder area, if it's up under the rib cage where the kidneys live. Those symptoms get us more concerned that you may in fact have a bacterial UTI that can actually cause some scarring and some permanent damage in those kidneys. We're always a little bit reassured if there's no fever, if there's no abdominal pain, and if most of the symptoms are more superficial where the pee leaves the body, then typically you're not dealing with a true bacterial urinary tract infection. If there's any concerns, get it looked at. A simple urine sample can be tested in just a few minutes in the office, and you can get a pretty good idea whether or not you're dealing with a bacterial urinary tract infection or whether it's something else. So the something else category involves a few things. One is that we can have vaginal yeast infections. We also quite commonly get what we call vulvovaginitis, that just is irritation and inflammation of that area. And for a lot of kids, a lot of our younger girls, that vaginal area is quite sensitive and pretty easily irritated. So if there's no fever, the symptoms seem more superficial in the vaginal area, then we usually will go the route of saying, hey, this looks more like we can rule out bacterial UTIs, we can get you on a topical antifungal, sometimes a mild steroid like an over-the-counter hydrocortisone cream, and can usually get patients feeling better and back on track pretty quick. There's two things that I always talk to my patients about when they have a vulvovaginitis or a vaginal yeast infection. One is to really look at how you're doing baths. We like kids to take baths in just plain water. If they're sitting in bubble baths and soaps and shampoos, especially bath bombs, things like that, they can be very irritating to that area, and kids will often start to have complaints. The other thing we look at real closely is potty training. If your child is working on potty training, we tend to have more withholding behaviors. We also have a harder time getting that area really clean and dry after using the bathroom. I'll usually suggest maybe doing flushable wipes instead of toilet paper, and for parents to really work on teaching those young potty trainers, especially our little girls, to wipe front to back and try to keep that area as clean and dry as possible. Loose fitting cotton underwear are good. They allow that area to stay dry. And if there is more of a vaginal discharge and you're getting thick drainage from that vaginal area, a lot of times those kids are going to require a prescription antifungal cream to treat it and get it doing better. So those are things to think about if you're worried that your child has a bacterial urinary tract infection or vulvovaginitis or vaginal yeast infection symptoms. Thanks, good luck.